being relatively young and healthy, I thought, oh, this can't be COVID. I just have allergies. I just don't feel great because I've been working so much. And then I lost my sense of taste and smell very abruptly and realized, oh, this is exactly what that is. And then realizing that, gosh, for the last week, I've been sharing food with my 19-month-old baby and my husband, and feeling both just horrified that I could have exposed them and, relieved that I wasn't more ill. But honestly, I'm physically fit. I work out and I do all of those things. And for 6 weeks, I couldn't. I was that debilitated by a relatively mild course of COVID. And I don't think that's something people are hearing. They're hearing, oh, people have asymptomatic cases or, 3 days of symptoms, no big deal. But that's not the majority. And also knowing that, gosh, it could have been much worse. And I know how much worse it could have been. I know exactly how much worse because of what I do. One of the things I'll remember, especially early on, was just all of the uncertainties, especially with respect to PPE, whether it worked, whether I was going to be putting myself and my family at risk by going to work. And I will really distinctly remember just how challenging I think communication has been. We take some of the sickest patients and we take them away from their families to begin with. And then we have to communicate all of that by phone or Zoom meetings with family members who are often also impacted by the disease. So we've had, multiple family members who are critically ill. We've in fact taken care of multiple family members at the same time. And just like the profound social impact this has had and how devastating it has been for some individuals and families, that's actually been something I think all of us have really struggled with. I went into critical care because I find a lot of reward in taking care of the sickest patients. And it's a challenge, and I do feel like every time I go to work, I'm making a difference. If I didn't feel that way, I don't know how anybody could do it. But I really do embrace that. And I enjoy going to work and I enjoy the teamwork that's involved in taking care of these patients. I mean, it's, working closely with other physicians, nurses, respiratory therapists. There's a large team involved in order to take care of these patients successfully, and it makes you feel like you're contributing to something.